Hello, this is Jess, and this is chapter 2 of the cancer talk that I am working on recording for you. I'm going to share my screen so you can understand what it is that I'm talking to you about. Sharing, fabulous. And so when it comes to prevention, a lot of our prevention works are in tandem with the team. So there are different prevention efforts and education that we conduct as nurses, but we also are part of a team on this. So there are times where we'll team with public health or with primary care to be able to get into prevention efforts. So there are recommended recommendations from the American Cancer Society screening breast cancer, colon, cervical, prostate cancer. So learning and practicing self-examination are hugely important. For universal lessons, when it comes to prevention, there are 7 general warning signs that a person has developing oncological problems. 1, change in bowel or bladder habits. 2, a sore that does not heal. 3, unusual bleeding or discharge from any body orifice. 4, thickening of or a lump in the breast or elsewhere. 5, indigestion or difficulty swallowing. 6, obvious change in a wart or mole. And 7, nagging cough or hoarseness. So you do not have to have all 7. Any one of the 7 things that I just listed deserves and warrants a further investigation into possible cancer for that client. So a few of the different things that we can teach about when it comes to people who have cancer, we can teach risks associated with planning them. We can encourage eating a balanced diet, all those nutritional factors again. Participating in regular exercise, that heart healthy exercise is so important, not just for your heart and for your lungs, but for cancer. Maintaining your health is important for cancer as well. Getting adequate rest, at least 6 to 8 hours a night. And then if we can help them eliminate, reduce, or change stressors and enhance the ability to effectively cope with the stressors, it'll go a long way. So I have an NCLEX style question for you. Boop. The nurse is planning a community education program related to prevention of cancer with the highest death rates in both men and women. So what should the nurse include in their teaching plan? Smoking cessation, screening with colonoscopy, regular examination of reproductive organs, use of sunscreen as protection from ultraviolet light. If you thought, hey, smoking cessation is the right way to go, you are correct, my friend. So smoking cessation is hugely important when it comes to cancer prevention, and the highest number of cancer deaths, regardless of site, is for cancer of, the highest number of deaths is associated with bronchial and lung cancer. And so the smoking is the leading cause of lung and bronchial cancer. So if we can get them to quit smoking, in addition to all of the other great variety of benefits that happen with quitting smoking, a reduction in the chances of developing lung and bronchial cancer are one of them too. One of them as well. So a diagnosis of cancer is really, really scary, as you can imagine. So the patient may be in shock and go completely dumb. They may experience fear and anxiety. So actively listening to a patient's concerns is huge. Not putting words into their mouth, managing your own discomfort, not jumping ahead to what you think they're going to say, but really being present in that moment with that person at that time is enormous. we really want to work on using written information and clear explanations so that way, if for whatever reason they're getting really overwhelmed with things, they have reference points that are easily understandable at another time. And as soon as it's possible, we should be advocating for a referral to an oncology team, bar none. Diagnostics that help the oncology team or help that determine where things are at in terms of the TNM and the classification of the cancer include a health history, a history of the present illness, identification of risk factors, smoking, other sorts of things, family histories, etc. Physical examination, and then there's specific diagnostic studies that happen. So some of the diagnostics include cytology studies, where we're taking samples and looking at the cells. Chest x-rays are helpful. CBCs and chemistry profiles are helpful. Liver function studies, endoscopy, radiographic, radioisotope scans. So radiographic studies like MRIs and CTs, radioisotope scans. We can give them, if we're worried about having thyroid cancer, we just talked about endocrine the other day, a couple weeks ago. If we're working on somebody with possible thyroid cancer, we could give them a little bit of radioactive iodine and see where it gets taken up and where it doesn't. If you have undifferentiated cells in your thyroid, they're not going to take up that iodine. The thyroid cells will. So we can kind of like parse out what's going on with thyroid by using some radioisotopes as well as other ones. PET scans are kind of the gold standard, but they're wildly expensive, and the scanners themselves are like not very common in the world. Like a lot of us are going to be doing our clinicals in Rochester at some point in time. Mayo Clinic is like amazing, right? They've got PET scanners. But for those people who are doing clinical in Lake City or in Cannon Falls, or even when I was working in Duluth and in Fargo, there were times where the facilities that I was working for didn't have a PET scanner, but there was a PET scanner in a truck. And so legitimately a semi truck would come with PET scanner in it, and then they would like do a glut of PET scans because the truck was available. We can look for tumor markers. We can look for genetic markers by doing DNA testing, for like the BRCA gene, for example. We can do molecular receptor status. We can do a bone marrow examination, and we can do biopsies. Let's talk a little bit more about biopsy. So biopsy obtains a tissue sample. That's all it's doing. And so then that tissue sample is sent to a pathologist, and the tissue can be obtained either by needle, otherwise known as aspiration. So they'll use like a large bore needle to aspirate and withdraw some of the cells from that. There can be an incisional procedure where they just, they'll make a small cut and then they'll take a little bit out of that tumor. There can also be an excisional procedure. An excisional procedure is where they actually take the entire tumor out. Whether it's incisional or excisional or needle really depends upon how far deep the tumor is. So let's say somebody has like an abnormal mole that's growing like right here on their shoulder. They could have an excisional procedure that removes the tumor, and then it's sent to the pathologist for classification. Sometimes breast tissue or tumors are done either usually needle, but sometimes incisional. Lymph nodes may be incisional. So it really depends upon how deep into the skin or under the skin, or how far under the skin the tumor is. And that is how they kind of pick what sort of biopsy you're going to be getting. I'm going to stop sharing here and make a different little, the next clip will be including interprofessional care. So stop recording here.